Good afternoon, everyone. My name is Dr. Guillermo Valenzuela. I'm a rheumatologist practicing in South Florida, in Miami, in the Fort Lauderdale area. I'm a rheumatologist who directs a center where clinical research is one of our main objectives. I wanted to talk to you today about giving you some pearls in the diagnosis and management of psoriatic arthritis. Again, I'm not going to be referencing any specific publication here, but I'm going to be talking to you about what I think is permeates from all the data that we have and how we can apply the data from the very many articles that we have in all this time we had with psoriatic arthritis and put it in practice in our patients. So one of the efforts that we are looking into now is the early intervention of the patient with psoriasis migrating into psoriatic arthritis. We call the early interventional studies, and where those patients, where's the intersection point at which perhaps those patients can be found and be treated as a psoriatic arthritis rather than psoriasis is one of the interesting areas where we are seeing more and more development. The second one, perhaps, it will be on how to identify patients, whether you practice in a setting where you run psoriatic arthritis trials or not, and how we can use a better clinical approach to identify patients. Remember, the majority of the patients who need to be included in the clinical trials need to fulfill the CASPR criteria. And one of the questions that I have from our students or other colleagues is what happens with the patient who they don't fulfill the CASPR criteria. Just keep in mind one thing. When you're looking for the psoriasis component, which is the skin component, other than the historical one, or if you're looking for a patient who doesn't have a historical component, I recommend everyone to become a glorified dermatologist. In other words, just use all your skills as clinicians and think about a dermatologist and do extensive workup. One of the major problems that we see in our patients when we see in second opinion is that the diagnosis of psoriatic arthritis is missed just because of the lacking of a diagnosis of psoriasis when the familial component is not there. So I recommend you to do what our colleague dermatologists ask us to do, and when you're evaluating a patient for the first time with polyarthritis whom you don't know the differential diagnosis yet, just examine the patient very well, and that means put the patient in a row and examine them, the full skin, ask the proper questions, and take the shoes off, look at the nails, look for every single element that you can use. Remember all the different domains in psoriatic arthritis, so make sure that all of those are explored. If you have the ability to do radiographs in your office, just do it. So I use this segment that I was allowed to do just to remind you about the importance of that, and I invite you to also to review all the publications on psoriatic arthritis that we have during this meeting here, and I would like to thank also Room Out for this time, and I invite you to swing by the booth. Thank you again, and good afternoon.